I'm Mayor Lyrian Gaylor-Baird, and welcome to this community briefing on Lincoln and Lancaster County's pandemic response efforts. Thank you for joining us to learn more about how you can protect yourself, your loved ones, and our entire community. And thank you as well to Margie Prop for providing interpretation. Throughout this pandemic, my family, like many of yours, has ordered a lot of takeout. We do our part to support local restaurants, and Honest Abe's is one of our favorites. It was a favorite long before the pandemic began because where else can you get bourbon bacon apple jam or kettle chips on your cheeseburger, or get sprinkles in your birthday cake milkshake? And while my son loves the milkshakes most of all, I've always loved the vibe you get there too, surrounded by all the framed pictures of Abraham Lincoln labeled dapper and awesome that just make you feel good about living in a city named for our remarkable 16th president. Now, before you think this news conference is going to morph into an infomercial for Freedom Fries, let me explain why I'm thinking about Honest Abe's right now. On the wall of the restaurant, along with those dozens of images of President Lincoln with his famous beard and his stovepipe hat, hangs one of his most famous quotes. "Give me 6 hours to chop down a tree, and I will spend the first 4 sharpening the axe." These words are a really good way to think about where we are right now in our local pandemic response effort. We are focused on sharpening the axe. We are making the vitally important preparations that will help us topple this virus and clear a path out of the dark woods we've been living in for nearly 10 months. In our case, sharpening the axe looks like using our wealth of local public health and immunization expertise, combined with our recent experiences vaccinating frontline healthcare workers and others in Phase 1A, to formulate our plan to scale up and conduct mass vaccination clinics. I know you like the sound of mass vaccination clinics as much as I do. I know this because as more people in Phase 1A have received their first and second doses, many of them posting their vaccine selfies or vaxies on social media, more and more people are calling my office, our health department, and doctors all over town to ask how and when and where they can get the vaccine. We'll hold up for just a moment. All right. This is great news. We are grateful that so many people are eager to get the vaccine because we need the vast majority of the population, by some estimates as many as 70 to 85% of all people, to get vaccinated in order to achieve that desired herd immunity. We need the vast majority of people to roll up their sleeves and get vaccinated so that we can prevent further suffering and losses. The suffering and losses have been tough on our families, and we're thinking about them. Preventing further suffering and loss drives our incredible team at the health department to do the work they do every day, and I mean every day of the week. I'm not sure they even remember what a weekend feels like. Yet even with our dedicated health team working around the clock, getting the majority of our community vaccinated will take a while. It will take a while, first and foremost, because we simply have not received enough doses in Lincoln and Lancaster County, not even in Nebraska, to accomplish the task at hand. Demand for vaccine is outpacing supply, locally, statewide, and nationwide. So what do we do in the meantime? We prepare so that the minute we receive the thousands of vaccines we need, we are ready to put them into thousands of arms. We sharpen our axe. Now, what's clear as we work to put an end to the pandemic is that we are not sharpening the axe alone. And that's something we can feel so proud of as a community, our doctors, our nurses, our hospital staff, our city departments, our schools, colleges, and universities, our businesses, large and small, our cultural centers, our houses of worship. Our Lincoln community understands that we will get through this most successfully and safely by working together. In today's briefing, you will hear more about how our health team is working with and supported by so many community partners to make vaccine registrations and community vaccination clinics possible. You'll hear about how our health team is working with UNL on student testing plans. Working together has been and will continue to be critical to the efficacy of our pandemic response. In just a moment, Health Director Pat Lopez will share more about our local vaccination efforts and preparations. She and epidemiologist Raju Karkalapudi have some exciting news about a significant step forward in our local preparations, a registry that will enable our health team to contact Lancaster County residents to schedule vaccination appointments as soon as we receive more doses. Director Lopez will fill us in on the site that she and her team have identified for the community-wide vaccination clinics we intend to hold once more vaccinations arrive. She will also provide an update on local conditions and the reasons why, after 10 weeks in the red, our risk dial is moving to orange. Elevated orange, but orange nonetheless. And with this positive progress on our risk dial comes some welcome modifications to our directed health measures, which she will outline. Thank you to everyone in our community who has made this move to elevated orange possible. Let's keep the positive momentum going by doing what we know works, wearing our masks, washing our hands, watching our distance, and avoiding crowded places and confined spaces. These are the best plays in our playbook until we can get more people vaccinated. Now, I'd like to invite Director Lopez to come forward and share her update for our community.
Thank you, Mayor. We will start again today with an update on the COVID-19 vaccine. As of Monday, the Lincoln Lancaster County Health Department and its partners, Bryan Health, CHI St. Elizabeth, Lincoln Surgical Hospital, Blue Stem Health, the Lancaster County Medical Society, and our physicians in the clinic, as well as long-term care facilities, have been working together. Through St. Elizabeth, the Lincoln Surgical Hospital, Blue Stem Health, and Bryan Health, we have administered 14,800 COVID-19 vaccine. Vaccinations continue for those in Phase 1A, which includes healthcare personnel, emergency technicians, and residents and staff of long-term care and assisted living facilities. Starting this week, vaccine is now available for school nurses, dental providers, and others who are part of Phase 1A. That includes home health and hospice care providers who will also be receiving the vaccine. Hospitals have scheduled the last round of first doses for primary healthcare personnel this week, and the majority of the long-term care facilities in Lancaster County have given first doses to residents and staff. Many people are receiving their second dose of this safe and effective vaccine, including healthcare personnel and emergency medical technicians. Next up for vaccination is Phase 1B, and those priority groups have been expanded based on the updated federal recommendations that came out last week. Phase 1B now includes people with certain underlying health conditions identified by the Centers for Disease Control and Prevention that these individuals are at increased risk for severe illness from COVID-19. Also included in there are essential workers. To prepare for the expanded phase, we recently launched a survey to physician offices throughout the county, and they are assessing and assisting us in identifying patients in their 65 and over age group, as well as those with underlying medical conditions. The department is also actively working with numerous community partners who will help support vaccination efforts for Phase 1B. The plan is to open Phase 1B as soon as vaccine supply is available. We do not have a firm starting date at this time, but we will be providing more details in the near future as we learn more. As part of our readiness efforts for Phase 1B, today we're announcing a new online COVID-19 vaccine registration tool for Lancaster County residents that will launch at 8 a.m. Wednesday morning. This is a simple online form that allows people to register to receive the vaccine. The form is available in English and Spanish. It captures basic information that will be used to help determine what phase a person is in and when they can receive a vaccine. The information goes into a secure system and is strictly confidential. The registration is the first step toward getting a vaccine. During registration, you will be asked how you want to be notified when it is your turn to be vaccinated. When the vaccine is available for you, you will be notified and given an appointment to be vaccinated. It is important to know that you should not seek a vaccine until you have an appointment. At this time, Raju, one of our public health epidemiologists, will give us more details on the online form.
Thank you, Pat. As you can see, this COVID-19 vaccine registration form is in both languages, English and Spanish. We added accessibility options to this registration form, like increasing and decreasing of font size, and also speech to text option. Once you enable a speech option on top of the page, a speaker icon will appear next to the field, and when you click it, it will read out the option for you. This registration form, as Pat mentioned, captures very basic information like your name, address, phone number, and email. It will also ask your preferred communication, whether email or phone. We are also asking for date of birth and also any underlying conditions you might have had, as required by CDC and the state to allot the phases that you might fall in. Once you submit the form, you're registered to receive the vaccine. A confirmation email will be sent to you if you provided an email. The state of Nebraska is also planning to launch a statewide registration system in the future. And once that system is in place, these two systems will integrate and you do not have to enter the information again. Thank you.
Thank you, Raju, and thank you to all the members of our team who have played a role in developing this beneficial tool. The registration tool will be open to everyone, and we encourage those who are in the phase 1B to register soon. As you can see on the registration graphic, as I mentioned, the new tool will be live on covid19.lincoln.ne.gov tomorrow morning at 8 a.m. Family members and caregivers are encouraged to assist with vaccine sign-up if needed. We also understand that not everyone has internet access, and some people may want to connect with a real person. You can call 402-441-8006 for assistance with registration. We'll be monitoring call volume very closely and can make adjustments if needed. We are also working with community cultural centers so that they can help their members get registered. I want to take a moment to thank the other city departments who are helping us provide registration assistance. This is an all hands-on-deck operation with staff from the Mayor's Office, Parks and Recs, Lincoln City Libraries, and aging partners who are all taking part in this monumental task. As part of our vaccination efforts, we've been working with our community partners on potential locations for a vaccination clinic. Pinnacle Bank Arena has been selected as one of our first clinic locations. It will serve as a site for a Friday clinic that is open only to healthcare providers in Phase 1A. Again, the Friday clinic is for those in priority groups only, which is 1A. The arena has experience working with us on other events, and it is an accessible and climate-controlled location. We continue to consider other potential sites for vaccination clinics as more vaccine becomes available. And we may be using additional locations in the future to help serve the needs of the community. We are hearing from a lot of people who are eager to receive COVID-19 vaccine. From a public health perspective, we are encouraged by the enthusiasm. At the same time, we also know the progress in getting vaccine into people's arms is dependent on supply. And supply is one of the challenges we currently face in our vaccination efforts. Demand is far outpacing supply locally, statewide, and nationwide. The federal government sends vaccine allocation numbers to each state weekly. When the state receives those allocations, it determines how many doses are allocated to the local health jurisdictions. Once the health department receives the shipment, we go to our vaccination priority list to see who is next in line and work to get those doses into arms as soon as possible. We will continue to work with the state and push for more doses in our community. We will also continue to collaborate with our community partners to administer the vaccine we do receive quickly and efficiently. Again, vaccine is not yet available to the general public. When there is enough supply to start public clinics, we'll make an announcement, but it may take some time to get there, so please be patient. We'll continue to provide vaccine updates during these weekly briefings and through other channels. You will also find the latest vaccine information at covid19.lincoln.ne.gov and by calling 402-441-8006. You can also track vaccination progress with new information added to our COVID-19 dashboard. And please keep protecting yourselves, your loved ones, and the community by wearing masks, watching your distance, washing your hands, and avoiding crowded places, close contact, and confined spaces. Now I want to share a data update with you. As the mayor said, our COVID-19 risk dial has moved back into the orange for the first time since November 6th, when it went into red for the first time. This indicates an improving trend in our local data, and the risk of the virus spreading in the community has been downgraded from a severe risk to a high risk. When reviewing the past 3 weeks of data, we are pleased with the direction of the current trends. Some primary factors the health department uses to communicate risk to the public have been improving. One of those is new cases. Over the past 4 weeks, our number of new cases per week has flattened out and has had no dramatic increase or decrease. During these 4 weeks, weekly cases have not been much higher than about 1,200 cases and no lower than about 925 weekly cases. This past week, ending January 16th, we ended with just under 950 cases. Another area we look at is our 7-day rolling average. During the 4-week span, we feel we have also passed the holiday bump period from the end of December and New Year's gatherings. The 7-day rolling average chart of new cases shows a holiday bump, increasing from 134 on December 28th to 177 on January 4th. We've seen a steady decline since then to an average of 136 daily cases on January 17th. We also look at testing capacity. I'm happy to share that testing remains readily available in Lincoln and continues to be a very valuable tool in preventing the spread of the virus. The arrival of the COVID vaccine will not remove the need for testing at any time soon. We need to continue to identify those who are positive and prevent further spread by reducing close contacts. Those with COVID-19 symptoms must stay home, stay isolated from others, and make plans to get tested. The good news is that testing turnaround time is very good, and in most cases, you can expect your results within 24 hours. We also look at contact tracing capacity. With the average number of daily cases declining, the caseload for doing case investigations has decreased as well. This helps initiate contact tracing even sooner, and the percentage of new cases connected to a previously identified case has been over 80% the last 2 weeks. This also helps in preventing further spread by better identifying who needs to be quarantined due to close contact with someone who has COVID-19. Over the previous 2 weeks, 100% of case investigations were completed within 2 days of the health department receiving a positive test notification. We also look at hospital capacity. Just as our weekly case counts have flattened out, so have our daily hospitalizations of COVID-19. Hospitalizations have hovered around 100 for the past 4 weeks. Today, we are reporting 116 hospitalized, with 79 from Lancaster County and 37 from other communities. And unfortunately, we continue to lose members of our community to COVID-19. Today, we are reporting 4 more COVID deaths, bringing our total number to 185 in our community. I want to share the color gradient map with you. This color gradient map shows how our local metrics are plotted by color-coded risk related to the risk dial. You can see that the average testing time, turnaround time is now near green. Contact tracing has moved down to into yellow. Connected cases and ICU availability have moved further down into orange. The rest of the metrics have improved some, but still remain in red. You'll find the location of the risk dial now in the upper orange section, represented by the blue square outlined in red. I also want to share our comparison slide that we've used in the previous weeks. This comparison chart shows where key indicators were on November 6th when we moved into red on the dial and where they are now. The 7-day rolling average of new daily cases is down from 159 to 135. The weekly case count was 1,244 when we moved into red. At the end of last week, we were at 942 cases. The 7-day rolling average of COVID-19 patients hospitalized locally was at 119 on November 7th. At the end of last week, we were at 107 patients. And finally, as I have mentioned before, an area of concern continues to be the weekly positivity rate, as it remains high, and at the end of last week, the rate was about 4% higher than the 24.8% on November 7th. We will continue to monitor the positivity rate as college students return to classes in the coming weeks and more testing takes place. With more testing being completed, we do plan to evaluate the impact on the number of positive cases identified and the positivity rate. With the dial moving back into orange, we will be adjusting the directed health measure to go into effect on Friday, January 22nd. Gathering limitations have changed. They are limited to no more than 50% of rated occupancy indoors and 75% of rated occupancy in confined outdoor spaces, which is not to exceed 10,000 individuals either indoors or outdoors. Large events, more than 500 people, may resume after event plans are approved by the health department. Parties continue to consist of 8 or fewer individuals and must remain 6 feet apart in restaurant, bars, and other food service establishments. The occupancy remains limited to 50%. Individuals must remain seated unless ordering food or drinks, using the restroom, or participating in games. Anytime individuals are not seated at tables, they must be wearing a face covering. Establishments may now remain open and serve alcohol at all times pursuant to existing local and state laws, as well as restaurants. In youth sports, venues may seek Lincoln Lancaster County Health Department approval to allow additional spectators per participant if the specific venue can accommodate the increased capacity. Groups of spectators may not be larger than 8 individuals, and the spectators must maintain 6 feet of distancing from others. Door-to-door sales may resume and peddler permits may be issued. All individuals conducting door-to-door sales shall wear a face covering and abide by the no solicitation posting at any resident. It is great news to be able to move into the orange section again, but it's up to all of us to ensure this move is not short-lived. We must stay alert and continue to take necessary precautions to protect ourselves and those around us. Elevated orange still indicates that there is a significant level of COVID-19 in Lincoln and Lancaster County, meaning that there is an ongoing high level of transmission of the virus. At this level, residents should continue to limit interactions with those from outside their household, wear face masks, maintain physical distance, avoid gatherings, and only visit businesses that follow public health guidance, such as wearing masks, distancing, and capacity limits. We need everyone to continue to limit close contacts as much as possible. Individual outdoor activities are preferred, and small gatherings and events only with modifications, such as physical distancing, face masks, and capacity limits are encouraged. Avoid large gatherings. Continue to follow the CDC travel guidelines. We have demonstrated before that our collective action can improve our situation. The choices every one of us makes in the coming months will impact how soon we can move past the pandemic.
Thank you, Director Lopez. And when she says that it's an all-hands-on-deck time right now, she's absolutely right. I just want to take a few moments to thank a number of other folks who are helping us with our vaccine registry, and that includes the Lancaster County Corrections Department, the Lancaster County Extension, the Treasurer's Office, the Weed Control Authority, Lincoln Lancaster County Human Services, our Lincoln Transportation and Utilities Department, the Urban Development Department, and the Youth Services Center. It truly takes a village. Now, at the same time that our health team and all these wonderful partners have been preparing to administer vaccines on an unprecedented scale, they worked tirelessly with our partners in higher education to get ready to welcome college and university students back to Lincoln. Our shared goal is to keep students, faculty, staff, and our entire city safe and healthy as thousands of students re-enter our community from across the state and country. And here to share more about those preparations is UNL Chancellor Ronnie Green. Welcome, Chancellor.
Well, thank you very much, Mayor. It's a pleasure to be here, and congratulations on the moving of the wrist dial back to high in the orange. We're very pleased to see that, obviously. You know, we have had a very careful and close and very productive partnership going back to March the 11th at the university, a date that all of us will remember well, at the beginning of what now is this global pandemic, with the Lincoln Lancaster County Health Department and Director Lopez and her team. And we can't thank them enough for their service and for the work that they have done to enhance the safety of our community. We had a very successful fall semester at the University of Nebraska-Lincoln. We were one of the very first institutions in the country to say that we intended to be in person as much as possible with our fall academic term this past fall. And it was successful. We were very pleased to welcome back a very solid enrollment to the university, where higher education saw in general a 16% decline in enrollment nationally. Your university at the University of Nebraska-Lincoln held its enrollment. And we couldn't have been happier about that, and proceeded with a very successful fall semester, albeit under obviously modified conditions in a global pandemic. We adjusted our calendar in order to protect our community and completed that semester early, the day before Thanksgiving, and our students, for the most part, then dispersed, went to their homes across the country, across Nebraska, across the U.S., for the past period since, leading up to this week. We also instituted a new thing for the University of Nebraska in 2 3-week intersessions between our fall semester and our spring semester that will convene this coming Monday on January the 25th. All remote, new offerings of courses for our students, where almost 4,000 of our students have been enrolled in those courses during December and during the current 3-week period ending this week. We worked hard to identify a way that we could bring our students back to campus safely, fully realizing a different season of the year that we would be in late January, and fully realizing that we were at the peak of this global pandemic at the current time. We also recognized that we had the opportunity to be even more in person than we were in the fall, from what we learned in the fall. where now up to 60% of our courses that our students are taking will be fully in person this semester, with all students who are in that course in class together at the same time, as compared to many of our courses were hybrid in format last fall, similar to what our local schools have been doing, with some students online and some students in person in order to be able to socially distance. Recognizing that opportunity lay ahead for us, we worked with the Lincoln Lancaster County Health Department to consider how we could enhance our testing to be able to move into that spring semester, gathering back our community of almost 28,000 people who will be with us for spring semester from all around the U.S. and around the world. And we're very pleased to now be offering re-entry testing for all students, all faculty, and all staff at the university who will be on campus for this upcoming spring semester. I just finished taking my saliva-based PCR test, providing my sample on campus by the stadium. Today, we expect to have tested or collected 4,000 samples for testing in our first major day of testing leading up to next week. That's on top of last week, having collected about 1,000 samples from students in the College of Nursing and the College of Dentistry in UNMC on our campus, as well as our College of Law and our partners at the Nebraska College of Technical Agriculture. By the end of this week, we expect to have completed 20,000 tests for reentry for our students and our faculty and staff to enable us to start on Monday. This will be followed by a second test of our community 10 days later that will provide us the full scope of information to know how to best contain any transmission of coronavirus and protect our community moving forward. And then we will have the opportunity to test as much as needed in order for us to contain that risk and to operate successfully throughout the remainder of the term as we move forward in the pandemic. We are excited to welcome our students back. I cannot tell you how excited we are to welcome our students and our community back to campus for what promises to be a wonderful semester. We are excited about the opportunity for vaccines to now be delivered, as we heard Director Lopez talk about and Mayor Baird talk about for our community. I can tell you I will be the first in line when my appropriate time is to receive that vaccine and to get that added protection for us to be able to move forward. So excited to have our students and our community coming back to the University of Nebraska-Lincoln and for our semester to commence on Monday morning. Mayor.
Thank you so much, Chancellor Green. Thank you for your leadership, for your partnership with our team at the Lincoln Lancaster County Health Department. And we are looking forward to seeing students again, too. At this time, I'd like to thank everyone for joining us and see if anyone has any questions.
Mayor, this is Brent with Channel 8. I have some questions for Director Lopez.
Great, thanks, Brent. She'll be right up.
Good afternoon, Brent.
The demand for the vaccine is far outpacing supply right now, and that's what's keeping us from moving into this next phase. How much more would we need to receive in order to move on to phase 1B? Are you able to put a number on that?
We need 6,000 more doses to be able to complete the rest of 1A so we can move into 1B.
And in talking with the state, do you have like a timeline as to when you might receive those doses?
We know that we will receive approximately 3,900 more doses next week. And I have spoken with them and made them aware that if we were able to get up to 6,000 doses, we would be able to work through and complete phase 1A by the end of next week.
Two other questions. One, you said there are some other vaccination sites being considered. Can you tell us what some of those might be and if there are any outside the city limits?
We haven't looked at any outside the city limits right now, but you know, Brent, it's going to depend on how much vaccine we have on hand. If we're able to get additional larger amounts of vaccine, we'll be working to get it in physicians' offices and other locations. We'll be looking at places like the Lancaster County Event Center. We may go out and do some sites in the county as we've done before. We'll definitely be going to some various communities within our community where we've gone and provided vaccine for those who are more comfortable at specific locations. We're also working on, we have many homebound individuals that are receiving services in Lincoln. We're working with Tabitha Home Health and our aging partners and others to assist in providing vaccine delivered in the home for these individuals.
My last question, you talked about the vaccine registration sign up and, it'll ask people questions to determine what group they should be in and when they're eligible. What measures are being put in place to, I guess, make sure people are being honest with the information they're putting in there and not, I guess, cutting in line?
Well, you know, Brent, we're asking about birth date. We are asking about any health conditions they have. Some of the other health departments have started a process using something similar in their area. You know, the thing is that we depend on people being honest in the community and remembering that if they are doing something that's really not appropriate, then they're taking vaccine away from somebody who's really in need of it. And I guess I think that the people in our community have great integrity and understanding of that. Everybody's going to get a vaccine eventually. Let's take care of those who are the most vulnerable first.
Would an ID be required when someone goes to their appointment to get their vaccine?
No. You know, we don't ask for, I want to clarify that. We don't ask people for an ID when they come to the health department for services, and we give thousands of vaccines every year. We have a birth date, we have a registry, we enter that in, and we have had no problems with people not providing their correct identification. And I don't want people to feel threatened by that or feel that they're going to have to present an ID to get a vaccination. The vaccine is for everyone in our community if we're going to really mitigate this virus and get it under control.
Hi, Director. This is Jeff Robb from the World Herald. Can I ask a question while you're still there?
Sure.
Can you preview a little bit for me what you will expect the mass vaccination sites or the clinic to look like at Pinnacle Bank Arena once things really get rolling? How often will you have them there? How many people will you move through? Can you explain that a little?
Well, right now, that all depends on how much vaccine we have. But we do know that every one of our nurses can vaccinate at least 44 individuals in an hour's time. It takes about 1.5 minutes to administer the vaccine. We can provide a vaccine for up to pretty close to 3,000 people in about 5.5 hours. Once we receive a greater number of vaccines, we'll be at Pinnacle Bank Arena as much as we are able to be there and not interfering. And Pinnacle Bank has been great about allowing us to be there. We'll probably be set up in the bowl of the arena to allow more room and more spacing for all of our nursing staff that'll be there doing the vaccinations. As we get more going forward, Jeff, and have the setup there without individuals there, we'll be sure and be inviting the media in so they can get a view of what it really looks like.
Lopez. Oh, Jeff, did you need to go again? I don't want to cut anyone off.
Oh, no, that's all right. I'm being reminded to mention that there's free parking at the arena. Go ahead, Jackie.
Okay, I was going to ask, once these vaccinations ramp up, what are you guys planning to do about like the high school basketball tournament at PBA or anything like that? Are you guys going to coordinate vaccinations and other events going on at PBA?
Absolutely. We'll be working around that. And like I mentioned that, that could be one of our major sites, but we may have other sites depending on what the weather is like and depending on other areas that we have a need for.
For sure. Who is helping with the online registration forms? Like, do you guys do that at the department level? Or are you hiring like other maybe private helpers to kind of coordinate the registration stuff online?
I think that the mayor mentioned several that we're working from the county extension, our urban development area, our health department, our aging, library, multiple other city areas and county individuals are assisting. Our library folks are all assisting. We're not contracting, if that's what you're asking, with another private entity to assist people with their registration.
Okay, thank you.
Uh-huh.
Hey, Director Lopez, this is Marla Lundak with Channel 8. Just for clarity's sake, Pinnacle Bank Arena will also be used for phases 1B and 1C when that time comes. Is that what we're understanding? And if so, who's going to be helping actually administer those vaccines? Will CHI and Bryan Health be helping with that?
Great question, Marlo. We have approached this as a community effort from the very beginning. CHI and St. E's and Bryan are both committed to that. Our private physicians are offering staffing as well for the clinic. We work closely with the Lancaster County Medical Society and our private physicians in this access. So our medical community is together and working with us. And they'll continue that work as we go forward.
Director Lopez, this is Bill with 1011. As you said, it's been 10 weeks since we last were in the orange, understanding that we're still in the high risk category. What's the overall message that you hope the people of Lancaster County take away from this move of a lowering of the risk dial?
I want people to continue doing what they're doing. That's helping us move into elevated orange, and to continue wearing their mask, watching their distance, and washing their hands, and avoiding crowded places. I think as we continue to do that, it's really working for us and our community. And, I'd be really excited to see us continue to move down into yellow and on into green as we get the vaccine more prevalent in our community and get this virus under control.
Director, this is Matt Olberding with the Journal Star. I've got another vaccine question for you, if I could. Many of the health districts around the state, in fact, probably more than half of them at least, have moved into phase 1B or are doing so this week. Is it an issue of, when it comes to vaccines, kind of how they've been doled out, has Lancaster County not gotten as much on a per capita basis as those counties have, or is it more an issue of we've had sort of a higher uptake among the healthcare providers than maybe they have in some of those other areas that's prevented us from yet moving on to phase 1B?
Okay. That's a really good question, Matt, and thanks for asking that, so I have the opportunity to share again. The state allocates vaccine on a percentage basis, and you brought up one of the things that's very prevalent here in our community. People are anxious to have the vaccine, and they want the vaccine, and we've had a really high rate of people becoming vaccinated, which is fabulous as far as I'm concerned from a public health perspective for our community. In the other parts of the state, the uptake and the interest in receiving the vaccine hasn't been as great as it is here. So that's allowed those areas to move more quickly into that phase 1B. And you'll need to know that both Sarpy County and Douglas County and Lancaster County for sure are not, we're all in phase 1A, as well as one of my partner departments, and I believe they'll be moving soon in just south of here in Crete. Public Health Solutions is also still in phase 1A. Uh-huh.
Are there any other questions from the media?
Mayor Riley from the Journal Star. Kind of a dovetail question from what Bill Shammert had asked of the director, but you talk about sort of during the pandemic being able to sort of forecast for people expectations. Now that we're moving into eased restrictions, how do you feel that sort of helps the city's economy and consumers here make decisions with their lives in the coming weeks? And does the rites of passage in Lincoln years, like the basketball tournament, does this kind of help position Lincoln to still continue its traditions?
Well, throughout this pandemic, we of course have been focused on protecting lives and livelihoods, and they're really intertwined. As long as we have a raging outbreak here and across the state and across the country, it will be difficult to resume life as we knew it because that affects consumer confidence. So we are doing everything we can to control the outbreak, which will help us build consumer confidence and create safe spaces in our community so that people can feel comfortable shopping, going to work, and resuming activities. And that's what we're focused on each and every day. To that end, we have recently launched the recoverlnk.com website where businesses can register and inform the public about the public health precautions that they're taking to protect not only their customers but their employees so that people can navigate safely and understand where they might feel even more comfortable doing business. And so we are actively trying to support or lift up those businesses and make sure the public knows where they can feel safe shopping and moving through our community. Regarding basketball, we again continue to work with our partners. We're meeting weekly with folks in youth sports and the NSAA. Throughout this pandemic, we have been in communication with the events and activities that are so important to our quality of life. We want those activities to be able to resume as safely as possible. And so we do think that these modifications to the directed health measures will allow for that. And we're asking the public to continue these important public health strategies so that we can support our businesses and keep them as open as possible as we move forward through these next few months, which, as you've heard today, it's going to take weeks and months before we can get enough people vaccinated to kind of create that herd immunity. So in the meantime, we all have a role to play in protecting lives and livelihoods.
Mayor, another question for Pat Lopez.
You bet. She'll be right back, Jackie.
Okay, thank you.
Hi, Jackie.
Hi, me again. So today, Dr. Fauci said that people who have gotten the first dose should be the priority to get the second dose and not give someone else a first dose of the vaccine before them. How are you guys going about keeping track of second doses and who's had vaccinations and who still needs a vaccination, especially when you're getting ready to go into the next phase? How are you going to keep track of that?
Well, there's the registration form, but we actually have a process where this is actually entered into a registry. So we know when the second dose is due, when the first dose is given and the second dose is due. And everybody receives, when they receive the first dose, they get the date of their second dose and the time. So we have a very streamlined process to keep track of that, so people can come back in and get the second dose when it's due.
Okay, thank you.
Mhm.
Any other questions? Okay, well, it looks like there are no further questions from the media. And before we close, I would actually like to thank the media and all the journalists who are covering this news conference, who've covered the past ones, who are helping to keep the public informed. The strength of our local pandemic response effort and of our democracy itself depends upon the work you do every day. And I'd also like to thank Margie Prop once again for her interpretation work, as well as all of our translators, our cultural center partners, and our friends at the Lincoln Commission on Human Rights, who enable us to reach more of our community members in multiple languages spoken here in Lincoln. You help us fulfill our commitment to taking care of everyone who calls Lincoln home, no matter where they were born or what language they speak. And thanks as well to all of you who are watching, listening, and leading by example. You don't have to be a famous president with burger restaurants named after you to be a leader in this fight. The pandemic affords each of us a chance to lead in this monumental collective effort to protect lives and livelihoods. We could not have made this progress into elevated orange on our risk dial without you. So keep it up, friends. Keep leading. And remember, right now, leadership looks like wearing a mask, washing your hands, watching your distance, and avoiding crowded places and confined spaces. Thank you.